Coming to you live from PRS View Studios, this is your Plastic Surgery Minute.
So we're incredibly privileged to have Deb Johnson, who's the current American Society of Plastic Surgery president, who works in California. So can I ask you a really important question? Why should a patient choose an ASPS member surgeon?
Oh, so, there are so many people who claim to be plastic surgeons. There's so many people offering plastic cosmetic surgery. And as we all know, not all of them are plastic surgeons. So being an ASPS member assures patients that the person providing the service is board certified, they've passed rigorous examinations, they have good experience in the procedures that are being offered, and we feel that it really gives the patients the highest standard of quality and patient safety, because that's the singular focus of ASPS, is to make sure our patients are safe.
And can I ask you, as a Brit, do you welcome international members?
We do welcome international members. Actually, almost a little over a quarter of our membership is now international members, and we are so thrilled because for two things: it allows us to learn from our international colleagues because they have much to teach. We can teach back, so there's good networking. It lifts the level of plastic surgery care worldwide. We're really focused on lifting patient safety worldwide as well. So I think it's going to be a win-win, globally, to have residency training standardized, to have patient safety standardized, and to have all of us learning from each other so that we can increase the quality of patient care.
Fantastic. And on a completely different subject, can I ask you, how can I keep my face looking younger?
Well, you're already looking quite young, Olivier. But I think in general, people need to start young, and I think parents need to school their children in sun protection and make sure that their kids are not getting sunburned, that they're protecting their skin when they're swimming or in the sun. And then as you enter your teenage and 20-somethings, starting to work on really being careful again about sun exposure, but doing things like good moisturizers, starting on alpha hydroxy acids to exfoliate your skin, and then ultimately working into the vitamin A derivatives, Retin-A, Renova, Tazarac. Those are all very helpful for continuing to improve the thickness and quality of our skin. And then ultimately just being careful with skincare. When you notice things, being a little bit proactive. We have lots of non-invasive things that can help maintain the quality of your skin, maintain the thickness of your dermis, keep you looking younger longer. And so I think, the good news is we can keep people looking better longer. The bad news is we're not operating on them as early as we might have in the past, but it's a win-win for the patients. So ultimately, patients may require facial plastic surgery, and we're well ready to provide that when the time
through their whole life.
Yeah. So I think consulting with a plastic surgeon, early in your 20s, to kind of develop a game plan moving forward to get the best advice on how to care for your skin, and then knowing when you need to move up a step as far as skincare or perhaps surgery is a good plan for anyone who wants to look young for as long as they can.
Fantastic. Thanks for that overview.